Okay, first of all, I want to thank Manu de Grassa for inviting me here today to tell you a little bit about my non-for-profit organization, IAABU, that stands for International Actions Against Buruli Ulcer. My organization actually is what I qualify to be a partner of choice for fighting Buruli ulcer. Now, what is Buruli ulcer? Buruli ulcer is a skin disease that is caused by a bacterium called Mycobacterium ulcerans. That bacterium belongs to the same family as the one that causes tuberculosis that most of you know very well. Mycobacterium ulcerans, it's relatively difficult to fight. However, some chemicals exist that are able to kill that microorganisms. However, in the treatment of Buruli ulcer, things are a little bit complicated, and I will explain this in a few minutes. So, Buruli ulcer actually starts with, most of the time, a painless nodule or a papule that at some point bursts, and when the papule or the nodule bursts, the toxin that is produced by the bacterium is going to eat literally skin cells and causing necrosis of skin tissues, and that necrosis can evolve into large ulcers. Now, most of the time for the treatment of Buruli ulcer, some antibiotics including streptomycin and ampicillin are used in small ulcers, and in general those antibiotics are able to treat successfully the ulcer. However, because the beginning of the disease is characterized by painless nodules, and in the case of small ulcers, painless as well, people do not feel the urgency of going to seek treatment. So that gives the chance the toxin to do its work, which is to destroy skin cells, and people end up with very large ulcers that are most of the time not treatable with antibiotics. So the only way to treat those ulcers is to do skin grafting. Okay, so basically there will be a removal of the infected part, and skin is taken from some part of the body and graft on the region that needs to receive that skin. So this is what is applied and recommended by WHO, the World Health Organization. So at this point of time, we know Buruli ulcer to happen in several countries in the world, over 30 countries. Most of them are located in the central Western Africa. We find also the disease in Asia, in Australia, in South America, including Mexico. So this is the endemicity. Right now there are several questions that needs answers. I'm going to just talk about those questions briefly. One of the questions is, what is the exact mode of transmission of the disease? Actually, at this time, there is a lot of speculation as of how the disease gets to human. We know the disease to be associated with swampy areas. However, we do not know how the disease gets from the environment to human being. Unless the person has a cut, we understand that at that point, if a child is in a contaminated area, in contaminated water, the wound can be infected. However, when the person doesn't have a cut, we do not know as of today how the person get infected at the first place. So the second question that really requires a lot of work nowadays, it's why do antibiotics has so little effect on Mycobacterium ulcerans? The next question is, how can more rapid and efficient diagnostic tests be developed? This is another area that requires attention. How can the population at risk be protected? And lastly, what is the actual incidence and prevalence of the disease? Now, one question that always comes when it comes to looking for research funds, it's what is the incidence of the disease? Okay, for us to be able to give you our money, we need to know the incidence of the disease. This is what people say. Well, actually, because the disease is a neglected tropical disease, well, not because it's tropical, but because it's neglected disease, well, there is not much attention that has been given to this type of question, which is what is the incidence and prevalence of the disease. We don't know that. So we as scientists, health professionals, we need to put ourselves together and get involved in trying to answer this question. So these are 5 major questions that we want to tackle. Now, IAABU actually stands in this as a partner of choice. What we want to do, we want to contribute as much as possible in finding answers to these questions, not only questions pertaining to science, but also questions pertaining to social aspects. For instance, a child, most of the patients actually that are infected by Mycobacterium ulcerans and who develop Buruli ulcer are children under 15 years old of age. Now, those children, in general, when they are admitted to hospital, are going to stay about 6 months. Now, during those 6 months, children are not going to school. So there is a chance that those children can be left behind. What if the child spends a year in a hospital? What is the schedule for that child to not be left behind education-wise? So we need to work, we need to develop a partnership with educators so that these children, while being in hospital, can also receive the education that is needed so that when they leave hospital, they are not left behind. They're going to be able to catch up with the school system. Now, another thing to take into account is that most of the time, people who are infected live in remote rural areas. Now, in remote rural areas, the economy, the place of ladies in the economic system is very important. And in general, ladies are going to do farming while the man, he is going out for a different type of job. Now, as the lady stops doing farming to attend one of her children who is in hospital, well, nobody else is going to be in a farm to take care of the farm, which is affecting the economy of the family. How is that family going to survive while the lady is attending, assisting one of her child who is in hospital? Now, the child can stay 3 months, 6 months, a year. Like I said, how is the mom assisting the child in hospital going to affect the economy of the family? So this is something that we also want to take a look at and be able to help those families. So we want to be able to raise awareness of people about the disease. Like I said earlier, Buruli ulcer, it's a neglected disease. A lot of people, even in endemic areas, do not know about the disease. So they need to know about the disease. And the more they know about the disease, the more likely not only they can avoid situation in which they would otherwise be infected, but also would be able to educate people surrounding them so that when the problem comes, the problem can be taken care of, or altogether they can even find ways to avoid to be infected. For treatment, what we want to be able to do is to approach pharmaceutical companies to basically support patients with low cost to no cost, okay, depending on the income of the family. We want to be able to also do charitable actions, like, for instance, providing medical supplies, prostheses for people who need those, because what I haven't said so far is that people who get infected, when they heal, because sometimes they heal, when they heal, sometimes they heal with deformities, okay? And in this case, people are not able to do basic life actions like taking a bath, being able to move from one place to another. So we want to be able to collect some items like wheelchairs, prostheses, like I said, and this would help these people live a normal life. So I already kind of underlined some scientific questions. This is also something that we want to get involved into, supporting research initiatives that are going to lead to either finding new treatment or finding ways to prevent the disease. We want to be able at IAABU to support research initiatives.